This is the lumbar spine extension screen tool for back pain and leg pain. The first step is to set a provocative baseline that they can do in front of you or on the call with them. For back pain, this might be something like bending forward, or for hip, knee, and ankle pain, this might be walking or doing a squat. Just something that will reproduce or increase the intensity of the pain that is reliable and distinguishable so that they can understand if the exercise you're about to give them is actually working. So you're going to retest this painful baseline immediately after doing 10 to 30 repetitions of the screen to see if there's been a significant change in either their pain intensity, their range of motion, or both. First of all, show the patient the exercise. It's the easiest way to get them to do it properly. And as you can see the individual doing the exercise in the video, you have them lie on their stomach and say, push yourself up as far as you can and see if you can get to the point where you can lock your elbows. If you can't lock your elbows, tell them to move their hands up further than where the individual's hands are in this video so that they are not going up as far. And this would work if somebody has less range of motion than the individual in the video. As you can see, they have a lot of range of motion into extension for the lumbar spine. Once their elbows lock or they are as far as they can go into lumbar extension, just get them to relax their butt muscles and their leg muscles, breathe out at the end, and let the back sag. They don't have to hold this for very long. They just have to get to the point where they are as far back as they can go, relax, and then back down. Repeat this lumbar extension screen 10 to 30 repetitions depending on the patient's tolerance level. You may want to do it 10 repetitions at a time. Pause, check in with their painful baseline, and then do another 10 with another pause after that, and then another 10 repetitions to see if they have any significant changes. Then get them standing back up, retest the provocative baseline, whether that's walking, squatting, or bending forward. If there is a decrease in either the pain intensity, improvement in range of motion, or both, with the provocative baseline, you can tell them this gives you some good evidence that they have one of these very simple fence post tight joint problems in the lumbar spine. You can send them away with 10 repetitions every 1 to 2 hours for a 72-hour test period. If over the next 72 hours of that testing period, they notice a significant improvement, you can follow up with them in 1 to 2 weeks, and then you can see if there's a significant improvement. And if so, you can just encourage them to continue doing this exercise on a regular basis, ideally until the pain is either nearly resolved or fully resolved, and then get them on a prophylactic management program where they just do this exercise 1 time per day, 10 repetitions. If they are not better from this exercise, you can always refer them to a mechanical diagnosis and therapy trained and certified clinician in the community by Googling McKenzie Institute and then the country that you live in to find a list of providers that are trained in MDT. You can also visit www.disruptionmsk.com to find a list of providers that are highly trained in MDT and able to deliver this high quality care and give an accurate, precise diagnosis for lumbar spine and lower extremity pain online without having any hands-on care. Now, if somebody has upper extremity pain like shoulder pain, or they're just too weak to do this exercise that frequently, laying down and doing push-ups, you can get them doing this alternative, which is lumbar extension standing up against a counter as a fulcrum. This is fairly common in elderly patients who are not able to push up because they don't have the strength in their arms. You can have them bend backwards over the plinth in your office if they're there, or if you're doing a Zoom call with them or on the phone, you can just have them back up to a counter that's usually about waist level, and then get them bending backwards over the kitchen counter repeatedly like this, as far back as they can go and back up. And that's it. You're now ready to screen for lumbar spine and lower extremity pain of spinal source using this screen. Now, I challenge you to take the next 5 patients that you see that come into your office with either low back pain or isolated hip, knee, or even ankle pain to do this lumbar extension spine screen, and you'll be amazed at how many people you find that get significantly better with just 10 to 30 repetitions of this screening tool.